Well, an interesting study came out just this past week, and it talks about the fact that arthritis sufferers a quarter of arthritis sufferers have an increased risk of heart attack, even if they have no heart disease symptoms whatsoever. And those with rheumatoid arthritis have a 50% chance of, greater risk of heart attacks.
A sudden one too.
A sudden heart attack. It must be the cholesterol.
Yeah, absolutely. We've been talking about this for years. The importance of checking your biomarkers, especially that biomarker inflammation. A lot of people ask me once they get their results back, Dr. Martin, you said I had high inflammation. What do you mean by that? I don't really have any pain. I said, yeah, but if you have elevated levels of insulin, elevated levels of cortisol, these things can be silent. You might not know you have them, but we call inflammation the silent killer because, again, inflammation at the cellular level, inflammation at the, in the blood vessel area, it damages blood vessels. So cholesterol really, why do 70% of people that have a heart attack have normal cholesterol levels?
Well, and it's interesting because, now the experts are starting to say, well, maybe inflammation has something to do with it. Maybe inflammation is, obviously, what's a characteristic of arthritis is inflammation. Studies have also shown that increased oral inflammation can increase heart attacks. I think it's about time that the focus is shifted away from cholesterol and shifted towards inflammation. And again, biomarker testing is a fantastic way of checking inflammation status long before it becomes an issue.
Yeah, and when we write newsletters and this and that, we always talk about disease or sickness without fever. And again, that's a biomarker what we're looking at.
Inflammation is the new fever.
Yeah.
Inflammation is an indication that your body is not running optimally and there's a problem. The nice thing is that you can detect inflammation, you can deal with it long before it becomes an issue.
Yeah, and one of the major symptoms, by the way, of inflammation, like in terms of what does it do to your body, makes you tired.
Yeah,
energy. Almost invariably, every time we get someone that has high inflammation levels in the body, what do we see?
Yeah,
they're fatigued.
Rarely does somebody come in with high inflammation levels and say, well, my energy's fantastic.
Yeah.
Generally speaking, they come in, they got no energy, and you do the testing, and sure enough, they got high inflammation levels. We put out a newsletter this past week. Energy levels, especially if you're not feeling good, that's a check engine light, right? That's your body saying there's something wrong. Yeah. Generally speaking, the lower the energy is, the higher the inflammation.
Yeah. And your body just trying to give you clues, that something's going wrong. It's not right. It's not normal. It might not be disease, and unfortunately, the traditional testing waits till you get sick. Where you literally can put a label on a disease.
Yeah, it's a diagnostic testing.
It's a diagnostic testing.
Which is true. You go get diagnostic testing. Well, the nice thing about biomarker testing, it's not diagnostic. We're not looking to diagnose a disease. We're looking to find something so much prior to becoming a disease. Yeah. The first clues that your body gives that something is heading down the wrong path.
Yep.
Well, tune in next week for a new video.